India has issued guidelines for the treatment of COVID, dividing them into mild, moderate, and severe symptoms. Few things about these guidelines are excellent. Most of the things are okay. One or two things are completely wrong. They are like colossal blunders, unmitigated disasters. We'll take a quick look at that. This video is basically mostly for my physician colleagues, but other people are welcome to watch it. This is not a medical advice, obviously. You look at your own studies. I would say one thing, the ICU doctors deal more with tocilizumab and ventilated patients. The outpatient doctors deal more with whom to screen, whom to send to the hospital, like mild to moderate. Some doctors monitor people at home. Our practice does all three. We see patients daily in the clinic, monitor them at home, and we also round in ICU. So we do have the experience of dealing with all three arms of this patient load. First thing I would do is I'll remember our ancient Indian science and look at the patient first before you prescribe a medication. See what kind of patient you are dealing with. So I would first classify the patient into two groups. One is low risk and other is high risk. And for high risk group, I will have a way, like, keep a very close eye on them. High risk is anybody with advanced age, high blood pressure, diabetes, cancer, COPD, smoking, end-stage renal disease, etc. And before we spew out all these guidelines and dissect them, I would say that the chance of ending up in the hospital with Omicron is 50% less than Delta. If you have taken two doses, that chance becomes even 60% lower. If you have taken two doses and you had previous disease, then the chance becomes even lower. India has crores of cases right now, I think, and hardly anybody is ending in the hospital. There's not going to be a Omicron third wave. India is already saved. We are talking about a select few that will go into the hospital, and we have to look at the treatment guideline. Now, let's say what the government is advising. People with mild symptoms, in the sense like some cough, cold, some the oxygenation is still more than 93, 94. They can be managed at home, especially if they're low risk. One thing that the Indian guidelines have done, and is commendable, is stupendous, I just love them for it, that they don't recommend anything. Means no Iver, no Mectin, Pavi, Pira, Vir, Zinco, Tinco, DC, Azithro, Doxy, WHO, nothing. Nothing. Beautiful. That's the way to do it. Nothing is needed. Just monitor for oxygen, just monitor for worsening of the symptom. If you want to take symptomatic acetaminophen, which is called Tylenol in India, which is fine. I would add one thing to it, and that is if you can do a single breath count, take a deep breath and count numbers in your mother tongue. Write that number down as an objective assessment of your lung capacity. I would do that twice a day. Otherwise, the guidelines are beautiful. Now, people with moderate symptoms, the oxygenation is less than 93. If they are high risk, I would send them to the hospital once it drops below 93. Obviously, they'll require oxygen. Now, the recommendation is to use either subcutaneous heparin or low molecular weight heparin. It's hard to do it in home setting. In United States, we tried aspirin and apixaban. That didn't work as well. You have to use heparin or Lovenox. And most doctors like to use the full dose. Use the full dose. If they end up in ICU, you can reduce the dose by half. But that's a separate study, too intricate. So that is a good recommendation to use low molecular weight heparin or sub-Q heparin. Now steroid. Here I think they have made a mistake. Um, the steroid dose they have recommended is 0.5 to 1 milligram per kg methylprednisolone, which is wrong. Suppose there is a heavy set person who is diabetic and he weighs 100 milligrams, he weighs 100 kg. So his dose of methylprednisolone will be 100 milligrams per day in divided doses. That is almost 18 milligrams of dexamethasone. That is completely wrong. Don't look at the weight. Just use either 32 milligram of methylprednisolone or 6 milligram of dexamethasone. 6 milligram of dexamethasone in one time dose. If you use dose more than that, you are inviting mucormycosis if you use it in more people. India The rest of the world has about zero point 0.7 cases per 100,000. India has 14. So India already almost 20 to 20 or more times more. So you are inviting mucormycosis. Another thing I would do is, if India loves to administer things, and India has done a beautiful job with the vaccination drive, they should do a strict check on who's prescribing steroids and what dose they are prescribing. Any person who has no degree, if they prescribe steroids and at a wrong dose, they need to come into trouble. There needs to be some legal action. This has to be careful. This brought mucormycosis. This has to be done. And the dose that is recommended by the current guidelines is also wrong. There's one more, I won't say mistake, there's one more problematic thing here. The Remdesivir. They don't consider it here, they consider it in more serious people. Remdesivir is an antiviral. What they're saying is exactly right. They should have said it during the second wave. It's very clear. Don't use it for more than 5 days. That's excellent. Don't use it till the oxygen drops. And don't use it if a patient goes on ventilator. Beautiful. If somebody is high risk and their oxygenation drops less than 93, at that time I would consider remdesivir for 5 days. We do things a little differently in US. In my patient population, if their oxygen has dropped and we put them on remdesivir, and if the oxygen level comes up, we stop dexamethasone, we stop remdesivir, and we send them home. Other doctors don't stop it. Once they embarked on remdesivir, they finish 5 days of that. So in moderate, the only thing different I would do is I would use a lower dose of steroid. In high risk, I would use remdesivir. I completely agree with subcu heparin or low molecular weight heparin. Now severe means less than 90, high risk. They obviously belong to the hospital. Oxygenation obviously. Dexamethasone, here they are saying up to 2 milligrams of methylprednisolone per kilogram in divided doses. It's completely wrong. Means 100 kg diabetic patient, are you going to give 200 milligram of methylprednisolone a day? This would bring a storm the likes of which we haven't seen in very few patients that we are doing it. No, just 6 milligram dexamethasone or 32 milligram of methylprednisolone. The dose that they're recommending is too high, it's too complicated. Don't do that. Heparin, fine. You may have to cut the dose if they go on go in ICU. Remdesivir, fine, for 5 days. Now there is a recommendation for tocilizumab. Here what I'm saying is most controversial. Tocilizumab is a very simple, straightforward. It's IL-6 blocker. Use it within 24 to 48 hours when the oxygen requirements are going high. Just do CRP. If the CRP is more than 75, use it. Use it in conjunction with dexamethasone. The most controversial thing that I'm going to say is, don't use tocilizumab in India. There's a lot of latent TB in India. There are not too many centers who are experienced in using this. Is like a boomerang. If you throw it and you don't throw it properly, it will come back and hurt you. So it's very difficult to use, especially in conjunction with steroid. And if the dose is as high as is the government recommending, it could bring disaster. It will bring a lot of infections. So you have to be really sure of your doctors who are using it. You have to look at their training, whether they have used tocilizumab before, where they have trained, and all sorts of things. I would say, like, don't use too much of it at all. Otherwise, the recommendations are fine. Hardly anybody is going to end up in the hospital with Omicron. Most people are going to get better. There is no third wave. I would do one more thing that is differently, that I would apologize to Indian people for not doing two things. There are two medications, if given early, within 3 to 5 days, those medications are almost 90% effective in finishing Omicron. One is given as just one injection and one is given as oral pills. 3 tablets twice a day for 5 days. Your weight has to be more than 40 kg. Those medications are ritonavir boosted Nirmatrelvir and sotrovimab. Those two medications are available all over the world. We are using it like candy here. Bangladesh has it. And India is not talking about. There is no talk. There is no apology. There is nothing. They're just talking about COVID appropriate behavior. This is COVID appropriate behavior. Explain to Indian people, Why ritonavir boosted Nirmatrelvir is not coming to India. Explain why sotrovimab is not coming to India. I wouldn't do that. Otherwise, the guidelines are fine. And I would actually commend the government for giving very clear, I think there are some flaws in it, but giving very clear guidelines so people can follow it and discuss it. Good job, Dr. Ravi Godse.